Jishnudev Verma, Honorable Governor of Telangana, and our esteemed guests, a very good evening to all of you. It's my pleasure today to welcome all of you to the India's Health Summit 2025, a gathering of some of the sharpest minds and most committed changemakers in healthcare. India's healthcare story is one of rapid transformation. We have seen incredible innovation, infrastructure expansion, progressive policy, and the relentless dedication to our healthcare professionals. Today, the sector already employs over 7.5 million people, and by 2030, we're looking at another 6.3 million jobs being created across hospitals, diagnostics, medtech, insurance, digital health, and so much more. But this isn't just about numbers. This is about transformation. We are not just witnessing growth. We are watching India's economic and social fabric take shape right before our eyes. But we also must face the challenges. Our doctor-to-patient ratio is much below than the WHO's recommended levels. We have just 1.7 nurses per 1,000 people. These gaps remind us that access and equity remain top priorities, even if we have come far. Interestingly, investment in the sector is growing fast. In the first 5 months of FY24 alone, private equity and venture capital investments crossed $1 billion, which is a 20% jump from last year. These funds are driving digital transformation, new care models, and the much-needed capacity building. The government is also stepping up. The 2025-26 union budget allocated nearly rupees 1 lakh crore for healthcare, a 10% increase over the previous year. A rupees 50,000 crore credit incentive program is also in the works to strengthen healthcare infrastructure, especially where it's needed the most. We're also witnessing a digital leap with initiatives like eSanjeevani, CoWIN, Arogya Setu, and of course the Ayushman Bharat digital mission, creating a connected ecosystem where citizens can securely access and control their health data. Still, the journey ahead demands more. We need to make healthcare fair and reachable for everyone, not just in cities, but also in small towns and villages. Strong primary care should be the starting point, helping people stay healthy and get the support they need early on. We must also give special attention to women's health, children's well-being, mental wellness, and care for the elderly. The EY FICCI report, Decoding India's Health Landscape, paints a bold vision for the year 2047. Over 5 million doctors, up to 15 million nurses, 100% health insurance coverage, a medical college in every district, goal, but within reach. If we bring together strong public policies, innovative private efforts, and a people-first approach, the real question is, what steps must we take today to get there? We need stronger public-private partnerships, more investments in skill building, R&D, and India-specific health innovations. We must empower patients with knowledge, support, healthcare workers with the right tools, and give policymakers the data to drive action. This summit is our moment to reflect, acknowledge the challenges, and openly discuss the future of Indian healthcare. Thank you, and here's to bold ideas, shared purpose, and lasting impact. Thank you.